Thank you so much for that kind introduction, and Tal, thank you so much for the invitation to speak with all of you today. I'm so excited to be here. We are, at the MMRF, huge believers in the precision medicine model, and it's really because we see three incredible trends in healthcare taking off, and precision medicine tends to bring all of them together. So we look at the science of genomics and immune therapy, and we combine that with the big data and digital revolution we're all seeing. But we would be remiss in not mentioning the patients and the consumerism we're seeing, where patients are really starting to understand and share their data as much as they can. Today, I was asked to come out and talk with you about the model that we've developed at the Multiple Myeloma Research Foundation. And I talk about how we developed it, but please know we developed it with the entire myeloma community behind us. I thank the entire community that started working with us, because the results in this fatal cancer are now astounding. Just think about this. Since we started our foundation, we have seen 10 drugs approved in multiple myeloma. 10. We have improved the 5-year survival by 40%, and patients no longer live that very sad 3 years that I got when I was diagnosed, but now it's more like 8 or 9 years. So the point is, we feel that if we can understand precision medicine and models like this in a very uncommon, heterogeneous, fatal cancer like myeloma, the truth is we probably can figure out precision medicine and ways to have progress like this in all cancers. So our model looks like this, and really it's been 15 years of work laid out in 3 simple blocks. And I'll walk you through them, but just to understand, first for us is our data bank. So everything we do at the MMRF is all about big data. We started with our own genomic initiative in about 2004 that we were doing with the Broad Institute, and it was based off of one-off tissue. But having done that, we also realized the importance of collecting genotypic, phenotypic data and doing it longitudinally. So we launched a $40 million initiative called Compass, which I'll talk with you about a little bit more. And once we started aggregating all of this data into our data bank, the most important piece was saying, well, okay, what are we going to do to put that data into the public domain, and then also make sure that other people were analyzing it. So within our learning network, that's where we tend to work with companies like Genospace that houses our data in a gateway and pushes it out for all the scientists to see. And then we also work with companies like GNS in Boston, where they take the raw data and analyze it to help us understand the pathways in myeloma. We then take all of that information and we drive it to the clinic. At the MMRF, we have our own clinical network of 22 centers that have all signed membership agreements with us. And those 22 centers do phase 1 and phase 2 trials with us. They're held to metrics: how fast are they opening, how fast are they enrolling, did the investigators bring new ideas, and together, at any one time, we usually have about 15 to 20 phase 1 and 2 trials going on that we're helping to spearhead. So I want to talk just briefly, because the patient is a critical component of this model, and understanding the patient piece is something that we focus on every day. So to give you an understanding of a program that we just recently did this year, quantitatively, we interviewed patients that were very familiar and educated by the MMRF, our organization. And then we also looked at another group that were not educated by the MMRF, had no awareness that we were out there. And then we put together a 12-step journey that we thought was very important for patients to go through, and we tried to find out how much more educated and willing the MMRF educated patients were to take the right journey. The next set of slides are pretty interesting. For those that are MMRF educated, looking at banking their tissue, over 3 times more likely to do it. Genomic testing, twice as likely to do it. Willing to share their data, much higher. And while we still have some work to do in terms of getting them into the trials, I think as we educate them on what your genome looks like, what precision-based trials are out there for you, this space is going to really explode for us as well. But I have to say now I'm very focused on MGUS in myeloma, or smoldering patients in myeloma. And the focus for us really as we move forward is not just treating people in precision medicine, but preventing people in precision medicine. And I think that's becoming really important to us at the MMRF. And the final piece is, when your father dies of kidney cancer, your mom has melanoma, and your sister has stage 3 breast cancer, and you know you have a model that works, the most important thing we can do at the MMRF is share it. Share it with anybody that wants to hear about it. And so I'm so humbled to be here today with all of you that have done such amazing, amazing work in precision medicine. I was so impressed with everything I heard yesterday. So on behalf of our family and everybody at the MMRF, I want to thank you for everything you're doing. And I want you to know that we're here to share our information in whatever way we can to help all of you and all of the patients we serve. Thank you so much.